Good morning, everybody. I'm a little bit of a wanderer, so you might have to stay with me. My name is Paige Baker-Braxton, and I'm a clinical psychologist. And I have had the privilege over the course of my career to work in a number of settings in private practice in Chicago, in hospital settings in Miami, Fort Lauderdale, in the VA. And now in rural Colorado, in Eagle County, I serve as the director of outpatient behavioral health at Vail Health, which means I oversee all of our outpatient programming. Today, I'm here with the primary goal of walking you through what Eagle County has done to respond to our behavioral health crisis. And if I really have one goal, it is to leave you all with hope that there are tangible things that you and your community members can do to address the behavioral health crisis. Because our community in Eagle County is very similar to Jackson Hole. To walk through this, I really want to start with describing our mountain paradise, which looks so much like the mountains here. We are a beautiful, European-inspired town that is beautiful in all seasons. Our lush valleys are spotted with wildflowers. In the fall, our aspen groves turn a beautiful golden. Honestly, I believe we are the most beautiful place in North America. But behind our paradise is truly a mountain paradox. We are a community of juxtaposition, a community of wealth and disparity, a community of opportunity and challenge, and certainly a community of wellness and pain. We are a community that has experienced and still is in a behavioral health crisis. Because in contrast to our incredible rural resort community, we have 55,000 residents. These residents support the infrastructure, the service industry, child care workers, healthcare workers like myself, county employees, and law enforcement. Of these 55,000 residents, 34% of our school-aged kids qualify for a free meal. Most of our infrastructure support are underinsured. Many of them live multiple people to a home. We are also home to one of the largest mobile home communities in Colorado, where we have multiple generations living in a single dilapidated trailer. And that is because our average cost of a home is $1 million. And as you move closer to Beaver Creek and to Vail Resorts, that number skyrockets to nearly $1.5 million, making housing unattainable when our median family income is $98,000. And if you think about Maslow's hierarchy of need, where our foundation is safety, security, housing, and food, of course we are in a behavioral health crisis. Add to that the fact that, flashback to 2019, we had one psychiatrist covering 2 counties. We had a handful of therapists. None of our behavioral health providers in 2019 took Medicaid. Very few took commercial insurance. So our community was left to pay $300 for a psychiatry visit, $200 for a therapy visit, making not only housing unattainable, but also behavioral health. There's also no inpatient psychiatric unit in our community. You have to travel at minimum 90 miles away, and really 120 miles away over at least one pass to access inpatient psychiatric beds in 2019. Add to that a lack of a coordinated crisis response, which leads to the incarceration of behavioral health needs, increased crisis, and increased suicide. We were a valley in crisis, a community in peril. And to highlight this even more closely, I'll share some data. That from 2015 to 2017, our ED visits for substance use increased over 300%. From 2015 to 2019, our ED visits for depression and behavioral health issues increased more than 400%. By 2017, 1 in 4 7th graders seriously considered ending their life by suicide. By 2018, we averaged 1 suicide attempt per day in our county. So you can see that our suicide rate climbed to over 183% in 2 years. We were in crisis. And we did what mountain communities do, what you all are doing here, We came together. We planned, we strategized, and we innovated a solution that worked for our community. In 2017, the voters of Eagle County voted with the highest rate to approve the marijuana tax dollars 100% to go to behavioral health services. In 2017, this allowed $1.2 million to be allocated to the behavioral health needs. In 2018, our community came together to do a needs assessment to determine what the services needed to look like. In 2018, Vail Health established Eagle Valley Behavioral Health, which was a nonprofit subsidiary that was intended to be the fiscal agent of these dollars. But what we soon realized is that infusing money to private practitioners was not going to create sustainable behavioral health. Because even with that money, Medicaid and commercial insurance didn't reimburse high enough for our private practitioners to be sustainable. So we pivoted, and Vail Health decided that they would bring all behavioral health services into the hospital setting. What we needed was money. The hospital itself committed $60 million to behavioral health. The hospital foundation, Vail Health Foundation, which is our philanthropic arm, created a capital campaign called It Takes a Valley, with the idea to raise over $100 million so that we would have $160 million over 10 years. We are now 5 years in. We have $90 million committed and $61 million in hand. So we are well on our way to reaching this goal. So what does this look like? Our goal over the next 10 years from 2019 forward was to increase prevention services, enhance access to outpatient and crisis services, build a psychiatric unit in our community, and evaluate and measure our progress. And I'm going to talk briefly about these two. Enhancing behavioral health services meant that we took a collective impact model. This collective impact model required that we were a community of collaboration, not competition. So what that means is that we came together with our nonprofits and our stakeholders and decided to come together to not replicate services, but have people that were already in the community doing the work get funding to continue doing the work. So we allocated $3 million to local nonprofits, our DV shelter, our LGBTQ nonprofit, and agencies that supported Latinx community and youth. In addition, we established scholarship funds. So Olivia's Fund is our local scholarship named after a middle schooler who died by suicide. This program is entirely donor funded and allocates 6 sessions annually for behavioral health care for anyone that lives or works in Eagle County. Vail Health Hospital also committed to extend their financial aid policy to enable anyone that makes 550% of the poverty line to access sliding scale and free services, not just for behavioral health, but for medical and surgical care as well. And one of the really unique things that Vail Health did is that they established an employee assistance program. I don't know about y'all, but every employee assistance program I have ever had allowed me 3 sessions with a therapist. That is not sustainable behavioral health care. What Mountain Strong, our employee assistance program, does is offer 12, 24, or unlimited sessions to employers in the Valley. We have 17 large employers in our community, including the school district, the county government, and a number of resorts that use our employee assistance program. Because what this does is it creates healthier employees and their dependents, but it also contracts with over 200 providers in the state, giving them an opportunity to stay in private practice while still getting great rates. We reimburse master's level clinicians $125 a session, clinical psychologists $145, and psychiatric providers $175 per session, which is significantly better than most commercial insurance contracts for providers. From the outpatient behavioral health side, which is where a huge part of our service delivery happens, the first thing that Vail Health did was become a community mental health center. That's a state of Colorado designation that enables you to get great Medicaid funding, get access to funding for services like crisis that are traditionally unfunded, and get access to federal grants because of that designation. But y'all, it was hard. It cost thousands upon thousands of dollars in the infrastructure of the hospital needed. In fact, they hadn't had a community mental health center apply in over 40 years. They had to build us an application because it is incredibly difficult to get. But through the process of becoming a community mental health center, that meant we got access to funds, but also that we had to provide outpatient and crisis services, which I'll talk about in a second. But in a very short amount of time, we have built nearly the entire spectrum of outpatient behavioral health. Currently, we have case managers, half of which are bilingual, bicultural, that address the social determinants of health that impact access to behavioral health. They do services in community and in our clinic. I have 17 licensed therapists with an additional 6 students from our APA-accredited psychology program and master's level training program. These therapists do individual, couples, and family. They also staff our intensive outpatient clinic, offering 9 hours of psychotherapy a week for our most sick patients. We also have an integrated behavioral health program that has co-located therapists within our primary care clinic that enables same-day warm handoffs. Our psychiatric team has 7 psychiatric providers, 5 psychiatrists, 3 of which are double board certified in child and adolescent psychiatry, and our 2 mid-levels do medication-assisted treatment. We've also hired a naturopathic doctor for which we do not charge for her services, so that everyone in the community can get access to holistic health care. We also offer the only transcranial magnetic stimulation machine on the Western Slope available to Medicaid, commercially insured, and private pay patients. So we are busy. From our crisis response team, Vail Health fully funds Your Hope Center, which provides 24/7, 365 co-mobile response. We're the only program in the state of Colorado that provides in-person, around-the-clock care. Our clinicians can go into people's homes, into community, to provide crisis assessments, place people on hold, safety plan, provide follow-up. They can be dispatched by the individual themselves in crisis. They can be dispatched by law enforcement, community paramedics, schools, or medical clinics. And while I think these services are incredibly impressive, I don't think it makes sense unless you look at it on the individual level. So I'd like you to meet Justin. Justin is 37 years old and moved to the mountains after college to work the mountain. But he never left, like so many people. For the last few years, Justin has been working as a carpet installer and has a job at a local bar. But over the past few months, his job went out of business and he lost his primary source of income. A few weeks ago, his live-in girlfriend broke up with him and took their family dog. Justin was facing eviction and continued to drink more and more and found himself in crisis. It was 4 a.m. one day, and Justin called the Your Hope Center crisis line. Ross, who is a licensed clinical social worker, picked up the phone. Immediately, Ross knew Justin was in crisis. He could also tell that he had likely been drinking. After a brief conversation, Justin agreed to let Ross and the community paramedics come into his home for an evaluation. Ross dispatched the community paramedics. They met in the apartment complex and rang Justin's bell together. Ross was able to perform a crisis assessment inside Justin's living room. What he found is that earlier that night, Justin had finished a 5th of bourbon, taken his gun from his closet, and placed it on his nightside table. Justin had plan and intent to die by suicide. Ross determined that Justin met the criteria for an involuntary hold. Because paramedics were on scene, they were able to transport him to the Vail Health ED. But it was winter, and the pass was closed. That meant Justin had to stay in the ED overnight before being transported to Denver for a 72-hour hold by ambulance, where he would have to return to the community by bus. Because he was underinsured, that cost was up to $20,000 out of pocket for transportation and the psychiatric stay. As you can see, this is where our system breaks down. Because we were able to provide crisis services in the home from people that had the same lived experience as Justin, but we couldn't treat him in our community. Now imagine it is May 2025, and the Precourt Healing Center in our community is opened. It is a 14 adolescent, 14 adult psychiatric unit. The Precourt Healing Center is just that. It is a place of healing. Single occupancy rooms with a mountain mural on each door. Scenic views of our alpine, beautiful, majestic background. A gym on each floor, open air rec, and a scratch kitchen because we know that healing your mind includes healing your body. The programming Justin would receive is a 7-day stay, not 72, because it's not just a place of safety. The Precourt Healing Center is intended to be a place where resilience is built. From the beginning, Justin goes through group programming, might go to art therapy, might have a time with our therapy dog, but discharging starts at the beginning. And in fact, Justin might even meet his outpatient clinician who comes and rotates through the hospital. After 7 days, Justin is discharged into our intensive outpatient program where he receives 9 hours of therapy and biweekly psychiatry. After that, he continues to meet with his therapist, Kayla, and is able to engage in the things that he used to love, the mountain. During his time and work with Kayla, he also comes out as a closeted bisexual man. He's referred to Mountain Pride, our LGBTQ nonprofit, where he goes to coffee with queers every other Tuesday, and he's getting ready to go to Friendsgiving with the queer and trans community of the mountains. Justin's story could have ended significantly different. But because he was in Eagle County with the resources that we have, Justin's story is not one of despair, it is one of healing. And if we're going to zoom back out to look at what this means, in just 5 short years, we have gone from a behavioral health desert with a handful of providers to the entire spectrum of inpatient and outpatient care on a single campus. In 2023, we provided 8,000 psychiatry visits, over 2,000 case management visits, 12,000 therapy sessions. We responded to 1,500 crisis calls, 545 which resulted in an assessment, and 82% of those were successfully safety planned and kept in community. We offered another 5,000 of Mountain Strong employee assistance programs, totaling nearly 30,000 visits in 1 year. And for 2024, we are on track to significantly exceed that. Eagle County doesn't always get it right, and we are still in a behavioral health crisis. But from somebody with the lived experience of living in a community much like yours, I want to leave you with one thing, and that's hope. Because there's the hope that the minds and the people in this room can generate innovative solutions that work for you and your community. And the hope that you, your family, and your neighbors can find healing. Because I firmly believe that the antidote to crisis and the medicine for trauma is hope. Thank you.